Okay, we're going to open the Board of Selectmen meeting Monday, May 18th, 2020, primarily for the COVID-19 discussion. So maybe, do you have information to share with us, or do you want us to ask questions? Usually Claire has some kind of points she goes over, but she's not.
We'd have 27 positive cases, and with 10 active right now.
Okay. So, that's almost double in 2 weeks.
It did, yeah.
Right, so I was thinking about that this morning, and then Denise had sent me a text with the updated numbers. And it seems to me that it's one or two possibilities. One, people may not understand what it means to self-quarantine or what the expectations are for self-distancing, which at this point I find that hard to believe. I mean, it's everywhere. Or two, people just aren't being as diligent with their social distancing and their mask wearing and, continuing to take caution. But,
I kind of think that's the way it is, because we've had some areas where people have a place in town, people who had it where they work, the place is all like spotless.
Yeah.
We've had the health agent over there, so it's, the people aren't getting sick from there. They're maybe following rules when they're at work, but when they go home, they kind of just get lax and they're just not doing what they're supposed to be doing. And it could be part of that quarantine fatigue going on.
yeah, I mean,
So-
that's the other thing I was thinking of, that it's, if it's for myself, I've been home from the office consistently for 3 months now. And I can see that it gets a little bit lax, and the diligence isn't still there, and, it's like, oh, it's just my neighbors, or it's just, someone I know, or something like
Right.
that. So I don't know what to do, but I mean, I don't want to see these cases continue to rise, doubling every 2 weeks, because we were doing really well in the initial onslaught of it.
Right, but we're also testing more too,
Right. So
so,
those numbers are naturally going to go up because of more testing. But I still think that,
And retesting.
and retesting, but I still think that people need to maintain their diligent behavior, even though the governor had come out with new kind of guidelines and new expectations over the next few weeks. It's still on each of us to kind of conduct themselves
Right.
Appropriately. Anybody else have any comments? Bill?
Yeah, most of these new households, or are they cases?
that you'd have to ask Claire on that. But Claire, I did tell them about the 27 cases and 10 being active, because that's what you had told Denise. I was off by 1 in my email. I thought it was 26, but it's 27.
27,
Okay.
say that again, Bill.
So, of the new cases, are these new households, or are these cases?
Some of them are
in the
new.
households?
Okay, actually 3 households came off quarantine, but we got some more quarantine people in the last week. And one of the houses that came off, there were 3 people, and the other 2, there were 5.
Okay, so this is not transmission within a household, these are new households that are
Correct.
picking up the virus?
Correct.
That's
Some of
even
the
more
people
alarming.
know where they contacted it from, and others don't.
Now, I was in Jerry's the other day, and they have the keynote in the back room there. And there were a few people congregating in there. Do we monitor that?
That's a health agent that monitors that stuff. They shouldn't be.
Initially, I think on the Keno, they're allowed to do it, but they're supposed to go outside and then bring back in their slips, and then they go out and they come back, but they're not supposed to be congregating, and this is the first we've heard of it.
Yeah, I ran in there last week really quick, and none of them were wearing masks, and they were all sitting in that back room, with the
Okay,
keynote
so then we'll
tickets.
have to have,
The only way we find out about this
Is
is
if someone tells us.
reports it.
yeah, reports it to
And
us.
people do report things like this occasionally.
Yeah, I know I did mention to Hardy that that's probably a no-no, that,
Was it less than 10, more than 10?
It was
Not
less
that-
than 10, you can't.
Not that it makes a whole lot
10
of
in that
difference.
little tiny room, there'd be a crowd.
Yeah.
Right. Yeah,
But the tables and chairs are not, you know, they're not distanced, there's not enough room
They
to
shouldn't be there.
distance any.
I thought those weren't even in there
They
originally.
shouldn't be there.
We'll let the health agent know and have him go check there then. Because I thought those tables and chairs were removed when this originally started.
I didn't think Keno was going to be going on. I thought you could go to the market to get essential food and supplies, and that was pretty much it.
Lottery
Well, but
still-
Keno is just the lottery, so people are sitting down and watching the numbers. They're not supposed to do that part of it. Keno hasn't stopped throughout this whole thing.
Right, because
So-
people go to the tea garden.
So I don't
For Keno,
understand
too.
how you can possibly do it without congregating. You have to, I've watched people do it.
You can watch it online. I
But
mean,
You
don't
can-
have
yeah,
to
you-
sit in a
yeah, you can get the numbers
restaurant or-
online.
Buy 10 tickets and go home and then check your numbers later.
Right.
You don't have
Oh,
to sit
yeah.
in the room.
Okay, I've
Right.
never done it.
So
you
the
know.
sitting part shouldn't be happening, but people
Correct.
can still play Keno.
Yeah, and people can still play the lottery.
Right.
You know, it's just, be more smart about it, I think.
So,
So should the back room be closed? Why is it
Well,
even
we-
open?
Well, it's open because that's where they have the keynote.
That's an entrance into the.
It's an entrance
One of
in,
the
but-
entrances, one of the egresses into the building.
Oh, okay, but then you come to the counter to buy the tickets, right? There's not like a separate Keno ticket.
No, you go to the
No.
counter.
Right, so,
you have a slip that you have to, just like when you fill out your slip for your lottery tickets, you have to fill out a slip for the Keno numbers too, and then you turn it in. And then you get a ticket.
okay.
But where the games, as opposed to, you know, the lottery, Powerball or Mega Millions or these things that take place once or twice a week.
Right,
Keno games go off every 10 minutes.
right.
So you play 10 games, you're sitting there for an hour or something, waiting for your games to finish.
So what's supposed to be happening? I wasn't aware that, I saw a lot of cards by there, and I thought maybe it was people that lived in the apartments around, but,
Well,
Well, there's
well,
that
now we
too.
have to let the health agent know, because as far as we knew, they were not having the Keno games in there. That was taken care of a few weeks ago, so,
Yeah, Keno games aren't a problem. It's
Right.
sitting there watching the games.
Correct.
And collective, I think, is more the issue than playing the games. I mean,
right.
you got the
So-
money, God bless you.
can they buy enough tickets to go home for the day and be happy with whatever?
Yeah, I mean, they
they're
could buy
gonna do?
tickets and go sit in their car too, and then
Yes.
come back
Oh.
in.
Yeah, you can watch it on your phone. I mean, you don't need to
Right.
sit in a
Okay.
public place together to watch the Keno numbers.
Right,
Okay,
Some places have them, have the TV screen up so they
right.
can see it
Oh,
from the
well, that's
outside.
what they
That's what they
have
have
there,
there.
Oh, from the outside?
so.
Okay.
All right.
Ed, do you have anything?
If I got it right, 27 positive cases and 17 have recovered, 10 active. That, okay. Yeah, and it stands to reason that there'll be more as testing, more people getting tested.
I was reading something a few days ago about the quick tests. I don't know if you all heard about it.
Rapid
but,
testing.
Yeah, they're getting false negatives
oh,
from them, so don't recommend that.
I read up to 15%.
I think there's only one place that's doing it, and that's in Lowell. Pretty sure.
Can I ask a clarification? Is it 10 positive cases or 10 quarantine households, or one and the same?
10 quarantines.
So there could
The
be more
households.
positive cases, but we have 10 quarantined households.
There would be more positives.
Okay.
There could be more positives, correct. Correct.
All set, Ed?
Yeah, I think so.
Kathy?
yeah, so the statistic person in me always is looking at the stats. So we're at, per 100,000, our rate is, was back on, I think this is May 13th by town, 365, as compared to Georgetown's up at 447 and Boxford at 453. So our rate per 100,000 people, overall compared to the surrounding towns, we're not leaping ahead of them. So
We're
in a
still
lot of
low.
respects, I want people.
Not as low as West Newbury.
No,
They're-
West
they're
Newbury's
really
got
low.
us beat, but we're in line with Merrimack, per 100,000 people. When you look at the rate of the illness per 100,000 people, which kind of puts everything on a comparable basis per town, we're certainly not the lowest, but we're definitely not the highest. So I think we have to be really cautious right now as we all get out there and want to socialize. But keep in mind that, you know, back at May 13th, we were really doing really well, obviously. Let's go back to May 13th and be really careful. Do you have any more information, though, on how this is affecting children? I've seen a couple of the news reports and pictures of it.
From what I've read, there's more children testing positive now. And, you know, they could be testing negative if they're tested and still be carriers.
Okay, but the way it's affecting them with the they showed some pictures of the swollen hands and feet. Is that the very young children, or are we talking all the way up to 18 years
Isn't
old?
that the,
I'm not sure.
It's an offshoot of this
I'm not sure.
COVID, but I thought they were trying to try to track this. They're telling doctors now to report this. You spoke to us about it, how it's a separate virus. It's affecting children with a rash, swollen hands.
It's the neurological
It's, yeah, it's more
kids,
neurological.
it's pediatric, something, immuno, something.
Right.
But they're connecting it to the COVID-19,
Right.
correct? Okay, are we going to track that in our town? Are you going to get notified if children in our town?
Anyone that tests positive, we find out about it.
Okay, but if they have that, again, I'm
that
not-
strain, is that what you're asking about?
Yes, the strain with the swollen hands, and they're connecting that to the COVID-19.
When I check with all these people and do their, you know, interview, initial interview, then I ask them what symptoms they're having,
Yeah,
okay?
so if
And
they
then
have,
I follow the symptoms because I call them, you know, back a few times.
but right now, the only cases that you're getting from the state database that you're following are adults. You're not getting notified that a child has this other
No,
thing that they are connecting to the COVID? No,
No.
okay. I just didn't know if there was, what kind of reporting was going on about that one.
Well, who knows if there's different reporting, and who knows, you know, how fast that reporting comes, because the regular reporting is days behind from the system.
Yeah. And, right, well, currently, the increased testing, is it mainly focused, are all hospital workers and nursing home workers, they're all getting tested right now, right? Is that what's going on in the state?
not necessarily.
Oh,
I just want to make an announcement. We've lost the Zoom connection, so Mike Dempsey was online. He was the only one, but we are reconnecting as soon as I can get back on.
okay.
Okay.
Should we wait?
No, because it's recording
Okay.
live anyways.
So, so you don't receive updates as far as what level of testing is going on in our area at the hospitals and?
As far as people going back to work,
Well, initially, the testing was just for people who had symptoms, right? That's how this all started.
right,
From what I'm reading and seeing on television, and again, different stations report things differently, so, and even newspapers and other things I read, it sounded to me, though, like they were going to test, whether they had symptoms or not, people who were working in the hospitals, people who were working in the nursing homes.
I really don't know if they're doing that. I think it probably depends on the hospital.
Okay.
You know, probably your in-town hospitals would be doing that more than a suburban hospital.
Okay. Thank you. I'm all set.
Claire, could you share with us the age groups, if you know, if that's something you can give us?
The most.
The age groups, like over 60, 50 to 60?
It's 50 to 59. That's, you know, where most of the cases are right now.
50 to 59?
And they've broken down all the rest of them, but I can't remember them
That's
in
okay.
sequence, you know.
A lot of these are healthcare workers?
A lot of them are.
Okay, thank you.
You're welcome.
Bill, you have anything else?
Testing, is it yet true that anybody that wants a test can get a test? Or are we still scrambling for test kits?
I think it really depends on the area that you're living in, the doctors that you speak to.
Okay, so you
That's
still
what I'm
need
gathering and talking to people.
we still need a doctor's order to get a test? we have to call
That
up one of
quick
these-
test in Lowell, I'm not sure that you need a doctor's order.
No, but
Okay.
I think you have to call up ahead of time and
You have
make
to
an
book it.
appointment.
yeah,
You have
make
to
an
book it.
appointment. And if you don't have the symptoms, my understanding is you're not gonna be accepted into that line. So,
You know, they keep changing things all the time, so it's hard to keep up with all these things, and, you know, I don't even know if, you know, if they're getting false negatives in that quick testing place, you know, maybe they won't be doing them as much, or at all,
I understand
in the
that
future.
the false negative could be as high as 15%, is that true?
I didn't see that. Is that what they're saying?
That's what I had heard on.
You're getting false negatives, but are you also getting the opposite, the false positives?
No, I mean, you know, sometimes I think when I hear stuff like this, Mike, that it all depends on the technique.
Right, because you
People
could
are
either do the
using-
nasal, or you could do the saliva, or whatever else they have.
I thought that the nasal was more accurate.
Yeah.
Have you heard anything more about the home test kits that they're now promoting?
No.
Nothing.
No.
So we're not sure how they'll work, or if they'll work, or what we have to do.
I know I read that CVS has, if they're able to, they have drive-through now for people to do it, but they hand the swab to them, and the people do it themselves. So I don't know how accurate that's gonna be.
You don't know if they're going up far enough into their nasal
Right, and if
cavity,
they're- yeah.
I've seen some of it online where people are doing, and it seems like it's almost in their brain. It's like
They go in there pretty,
pretty deep, yeah.
Pretty uncomfortable from what
Yeah.
I've seen,
Yeah.
people have said.
So I did want to move on to the information that came out today from the governor, which, in all disclosure, I did not have time to watch or read up on. But I did want to make a point that when you are talking to people that have been identified as being positive, we'll say, you know, whether it's a false positive or whatever it is, but positive, that I think the message that you're dictating to them, right? So this is the expectation, this is what you're required to do, self-quarantine, what that definition means, self-quarantine, so everybody is on the same page, and not have this kind of loose interpretation of what self-quarantining means. I mean, I consider myself somewhat educated and knowledgeable, and I can determine what self-quarantining means, but I'm not gonna put any kind of long guidelines on what it means. I want a strict definition of what's expected of each people, or each person, so that that message is consistent to everybody, so they know this is what I'm expected to do while I'm tested positive. This is what self-quarantining means. This is what I'm going to do for the next 2 weeks, and so on and so forth. I think that's an important thing that we have going forward, so that these numbers don't continue to double every 2 weeks like we're starting to see.
do you know that some people are getting instructions from the testing places
I don't
on how to
know.
quarantine?
That could
They
be
are.
an option too, yeah.
They are, and some of them aren't.
Right. So if you know, testing A and testing B aren't delivering the same message, then,
And people can say, yeah, I'm quarantining, but are they sneaking out to the store if they have to go?
right. Are you going for a walk? Are you going for a bike ride? You know, whatever that means.
I mean, I don't know. You know, they might think, oh, well, I feel really good today, so, you know, I can put a mask on and just go out,
Right.
but that's not the case.
And I think that consistent message, if it's not coming from a testing facility, it's coming from our health department, especially to the residents of town. I think that consistent message is important. So everybody knows, this is the message, this is the expectations. If you're required to self-quarantine for 14 days, this is what this means. Don't go for a walk, don't go for a run, don't go for a bike ride, don't go for a drive. You can go out of your house in your yard and then go back
Don't
in your
leave your
house.
property.
Yeah, well, that's a good starting point, right? Anybody else have on this?
Yeah,
Yeah, Ben?
to your point, what are the consequences of someone not following the quarantine or stay-at-home guidelines?
Well, we don't know if they're not. I mean, we tell them, but
In
Well-
essence, there are no consequences.
Well, for example,
you
if
can't.
I,
They would have to find someone
well,
and identify
you call
them.
me, you say, Mike, I've been notified that you've been tested positive, you're required to self-quarantine for 14 days. I say, okay, Claire, I know what that means, I'm somewhat intelligent, right? And then Saturday comes and I'm like, you know what? I'm gonna go for a walk.
It's a nice day.
And then Bill sees me walking, or the police drive by and see me walking. Is there any kind of punishment for doing that, knowing that
Well-
my household is supposed to be self-quarantined, or is
No.
it just?
no, because
Because we don't know it.
they don't
because
know.
of HIPAA laws, we're not aware of it. So you
Yeah.
could be walking down the street, or I could be walking down the street, or Kathy, or Ed, and because of HIPAA laws, we're not aware of the other person's level of contagion. And there is my point. You know, laws are great, but without consequences to follow the laws are irrelevant. So we can tell the people all we want and preach up and down and scream and yell and jump and say, you've got it, you've got to stay home, but there is no real consequence for someone that just doesn't want to follow the rules. That's true, right?
That's true, it's just,
So we are at the mercy of each and every individual we come across. We're only as strong as the people that want to kind of enforce this upon themselves, right? And if they don't, then we're at the mercy of these people, right? This is the part of the problem.
Well, you know, when you're talking to people, you know, you explain all these things and, you know, they, you know, indicate that they understand, you know, and you tell them how very contagious this is, so it's really important for them to quarantine and, you know, either, or go in the backyard, but don't go off the property.
Right, but Ms. Walsh, I feel fantastic. I can't believe I have it. I can't believe I tested positive. I feel great. So the minute you leave, I'm gonna go out. There's no consequence, and there is.
So who's gonna, you'd have to put a policeman or someone at
And
everyone's
you
house.
can't, because
Right.
that right away
I-
is a violation of the HIPAA laws.
Right.
Right.
So unless I disclose to everyone here or something like that, that I have it, and then if Kathy or Ed see me walking down the street, be like, Mike, you've already disclosed that you've had it, the town knows you have it, you shouldn't be out. You know, there's no punishment that the police are gonna put on me, right? There's no law that says that I get fined $300 or whatever the fine would be. It's just, it's up to me to say, I gotta do the right thing.
that's
what it
the way it
comes
is
down
for
to?
everybody. I mean, the only thing you get fined for in some towns is not wearing your mask, but
Right, which seems like a bit too short.
A clarification, when you have the individual, you said we have 10 active cases, the entire house is quarantined, right? So if other members of those house have jobs, they have to tell their employer they cannot
They
come to
cannot go to work.
They cannot go to work. And,
Someone has to come to the house, drop groceries off or prescriptions or whatever it
Right.
is on the porch
okay,
and not go in the house.
what, are these people that are quarantined, they are protected right now legally from their boss firing them, right, for not coming to work? Are they protected?
According
in
to
most
the
I
instances,
think
yeah.
they
Mass
are.
Department of Labor,
Okay.
they are, and if you have a problem, you are supposed to call them and let them know what your issue is. But
Okay.
again, I think it all depends on the willingness of the individual to follow the rules and accept their quarantine to not infect others. So we're dependent on each other.
Right, and we need them to do the full 14 days, no matter how they feel. I mean, obviously, if they still feel sick after 14 days, stay home. But if you feel great, after 14 days, go.
Is
That's
there,
it.
well, that's a good point. After the 14 days, is there a retest done, standard?
no, some places do and some places don't, because I can tell you, I know someone who had it, worked in a hospital, and once their 14 days was up, they were able to go back without getting retested.
Really?
And that's no guarantee that they're over it, right?
Correct.
Well, except that they had no, well, if you don't have any symptoms after 72 hours too, if they're fever-free
Yeah,
and
but you can still be a carrier,
so.
you know?
Well, we can all be carriers too, is that's the
Right.
whole thing. So we've not all been tested, so
But
it's
if
just
you,
such a,
if you work in a hospital, you tested positive, you're out in quarantine for 14 days. You're asymptomatic at the end of that time, and they said, oh, you can come back to work in the hospital and you work on a patient care floor, okay? You don't need to be retested, okay? What would you think of that?
I'm
Does
scared
that sound
already.
right?
Right now, I'm scared, because that doesn't make any sense. You know, if you took your car to a mechanic for a brake job, and you said I had no brakes, before he gave you back the car, he'd make sure the brakes worked, right?
You would hope.
You would hope, right? So it only makes sense to me that if you tested positive, before you're allowed to go back into the community, or back to work, or back to socializing, you should be required to be retested to make sure
Yeah,
you are
but
now negative.
That is by employer. Because I know some that are in a different field that they had to get tested in order to return.
right.
And maybe not just one test, maybe you have to show
It is
two
the
or,
employer.
it is by employer.
But that would be prudent.
But you would
It
think
would.
There's no
everyone that works in a
requirement, is what I'm
hospital
saying.
taking care of patients,
Right.
should they get retested?
Heck, yeah,
Okay.
heck, yeah.
So did anybody here have a chance to watch the governor's speech today about phased reopening?
No.
I
did?
watched some of it.
I watched some of it.
I didn't get a chance to, I was too busy at work, so.
Well, I guess phase one, we're going to open manufacturing, construction, and
Churches, places of
churches,
worship.
which,
That surprised me.
that surprised me.
Well, but it's only 40% capacity. You can't, it's gonna be, I think you have to, also have to actually like sign up that you're gonna be going to that particular mass. They're not gonna be collecting the tithes. They're probably gonna be putting the money elsewhere. It's not, baskets aren't gonna be going around.
How about cleaning? Are they going to be able to clean churches before people go in and out?
I would hope that
places of-
everybody's gonna clean
I don't know.
before
I
and
would
after.
think
who are-
that's gonna
from-
be up to the individual institution or organization, it's not mandated.
I would think they would clean it before anybody went in.
And when they
Although
leave.
now that they've been closed for all this time, there's nothing on the surfaces anyway.
Was that it, churches, constructions, manufacturing?
Phase one.
Okay.
Mm-hmm.
Now,
So, starting next Monday, though, hair salons, barber
that's
shops,
next,
one.
well, that's still
It
phase
is.
one,
Yeah,
but
that
that's,
is.
So-
Each phase is a minimum of 3 weeks.
So the
phase
25th
one
is-
is 3 weeks.
Yeah.
But
Yes.
next Monday, barber shops and hair salons can open again with restrictions.
and retail, curbside,
Curbside retail.
curbside retail.
Gyms are in like phase
And
3,
then,
and bars are in
Yeah.
phase 4.
oh yeah, casinos, museums,
Yeah,
hair
the
salons,
arts and
gyms
things.
are way out
Way
in
out.
Yeah.
phase
Like
four.
th-
You're looking
three-
at July,
3 or 4, yeah, they're way
I
up
think.
there.
Yeah.
Barber shops open,
You said next
Monday,
week.
the 20, as of the
Monday.
25th. Barber shops and hair salons.
but that's a by
Some-
appointment only.
Some veterinary places, I believe, was starting on the 25th.
Which is Memorial Day, so.
I know.
Yeah.
I had a synopsis of the
I
list.
thought what is phase 2? Did that have swimming in phase 2, or is that 3? I was surprised at
Swimming.
where I saw swimming, yep. I saw a quick look at it, because it was a little sooner than I thought,
I know that they want to, Monday as well, the parks,
yeah.
for, recreation, playgrounds and a
Full
limited
opening?
basis.
No, there's no full
Campgrounds.
openings.
No, not full, limited, restricted, I thought I read.
But that's
Or very-
statewide, so again, the town can have different requirements. So I would advise that we are not ready to open parks here. We are not ready to open playgrounds. We are not ready to open recreation space. We do not have the manpower, the funds, the staffing, or the resources to patrol these things, because it's still in limited capacities, and the number of people have to be limited, and social distancing has to be in place. We just don't have that ability. I've spoken to the police chief, and he is in complete agreement. If they have to have anything to do, we have one health agent who's part-time. We don't have the resources to patrol recreational areas and make sure people are following the state guidelines.
So we
I
can
would
designate.
recommend we are nowhere near ready to open our parks.
So we can designate parks for Groveland in whatever phase we want to.
We can designate everything in Groveland for it. I mean, we can't
Whatever phase.
stop, so we can't, I mean, we can be more restrictive than the state. We can't be more liberal than them.
Okay.
So yes, we can continue to function as we are. Many cities and towns have voted a mandatory mask requirement indefinitely. So even if the governor chooses to lift the mask order, which he has not, certain towns are still implementing it because there's just no way to enforce some of these things. I would say the same goes for the town hall. We will not be ready to open in phase 1 and likely not phase 2. We don't have the resources. You're talking cleaning every hour of every individual office, cleaning facilities, providing barriers, providing one-way traffic. We just don't have those resources. You know.
One-way traffic shouldn't be that. You come
Well,
in, you take a
one-way-
right, and
Well, I understand, but again.
it may take a
people
long
don't follow
walk
it
to
in the
get
food
over here,
store.
but.
Yeah, people don't
People
follow
don't
you.
follow it in
Yeah.
a food store when there's arrows everywhere. You know, I'm on a call every week with the governor's office, I'm on a call every week with all the 351 municipalities, and we're all sort of in the same boat. No one's complaining, the residents aren't upset that they can't get into town hall, the work is getting done, permits are being issued, bills are being paid, election stuff is moving forward. I think we need to maintain the status quo. The governor urged people to continue to work from home as much as you can, so I think we need to continue, and we will address it here on a week-by-week basis, whether or not, or when the time comes that we allow employees to return. And then that's gonna open a different issue because we have several offices not many, but we have several offices with multiple people in those offices, and how are we gonna handle that? And yet there's specifics with partitions that have to be required, and so those logistics are still being worked on. Again, I don't think we're there yet, and I would caution against opening any public areas.
Could you address upcoming town meeting and town election?
So right now, at which we can get to that now if you'd like. So the town meeting is still going forward on June 8th. The legislature has not approved the legislation yet to allow us to lower the quorum. If and when they do that, it comes with some restrictions, so that's something we will have to discuss. In order to lower the quorum, it can be not less than 10% of the required number. So for us, as I mentioned at the last meeting, we could lower the quorum to 11 people if we wanted to. The restriction, though, comes in, that's in the pending legislation, that it's limited to financial matters and matters of pressing situations. So council reviewed our warrant and gave me a list of the articles that we would only be able to entertain, which is fine, because as long as the budget's done, I don't care about the rest. But it's really the budget,
She's all about the
capital,
money.
town meeting,
Yeah.
community preservation, free cash, pretty much those would be the only articles. I've talked to the school, we've talked about spacing out the chairs. We have the auditorium and the gymnasium, should we need it. I have masks and gloves purchased for everyone that may attend. I have 1,000 masks to give out between the election and town meeting. I've bought plastic bags, so everyone will be handed a bag and gloves on their entry in. I've contemplated buying red and green paddles, so no one even has to speak through their mask. They just hold up a paddle, but I think you could just hold up your hand just as easy. So that's town meeting. If and when the governor signs that legislation, we can certainly revisit that. The only thing I would need to know is if the board wishes to move town meeting to one of the other Mondays in June. I would need to know that by this week, because I'm posting the warrant on Wednesday. So if the warrant isn't posted, this board has the authority to change town meeting. The other options would be the 22nd or the 29th, because the 15th is the election. So if you want to change to one of those other two, again, I don't think anything else is going to happen in those 2 weeks, but we would need to make that decision tonight. Regarding the election is going forward on Monday, June 15th. One of the provisions of the, one of the pieces of legislation that did go through was to allow the Board of Selectmen by vote to change the polling hours. The town clerk has submitted a request that she would like the board to vote a change in the hours from 7 a.m. to 8 p.m. to 10 a.m. to 6 p.m. That would give people still time to come in and vote in person if they choose to do so. We are obviously encouraging the vote by mail option. If people want to vote in person, they will be required to wear a mask. There is no way to social distance while coming into this room and dealing with the poll workers. We've purchased masks, face guards, plexiglass partitions for every poll worker. Cleaning supplies is still difficult for us to get our hands on, so I'm working on that. I purchased 5 gallons of hand sanitizer. I have scanning thermometers that just came in today. And now we're trying to work out the logistics of space. I would say to you on the 15th, I'm not gonna have any employees come to work. It's not fair to have employees come to work if we're lining the hallways every 6 feet with people. So that'll be a work from home day for everybody. And then the building can just be available to poll workers and those coming in to vote in person. That way, as least people as we have walking the halls, the better. And it will be a mandatory work, but we cannot have people in this building doing work and trying to go to copy machines if there's gonna be lines through the building. So that's just not a good, because we can't distance people that way. So I would ask the board to, right now, discuss and/or vote on the proposed to change the hours to 10 a.m. to 6 p.m. for the election day on June 15th.
And Mr. Chairman, I need to recuse myself as I'm on that ballot, so I'm gonna just leave the room and let me know when you guys are done.
So the typical hours are 7 a.m. to 8 p.m.,
Yes.
and she wants to limit it to just a straight 10 a.m. to 6 p.m. for 8 hours.
Yes.
What are some of the other municipalities doing?
Some are doing much less. 10 to 6 was actually generous compared to other communities. Part of the problem that we're having, that all towns are having, is staffing. We cannot find poll workers that want to work and subject themselves to that kind of crowd, those kinds of crowds. We've talked about putting it out to employees, putting it out to the library employees, but they don't even want to come into an empty building. Everyone's too afraid. So she was putting a call out today to see who's interested and who can work the polls, but that's the issue, is no one wants to work them. So that's the main reason why we're able to lower the hours of the
Do we have an idea of what the percentage of people are doing as far as mail-in ballots?
No, but I would say there's a significant number coming in. So I will continue to hype that for the next 3 Tuesdays in my weekly call. I send out, anyone who signs up for our email, there's about 920 people that get our email. I attach it at the application. I know there are protests on Facebook of people demanding to vote in person. I get that, but you're gonna have to wear a mask, you're gonna have to, even gloves, people are some towns are requiring gloves and bring your own black pen. They're not even providing pens anymore. So those are the logistics we're still trying to work out, but
So if I come in and I want to vote in person and I have my, for lack of a better term, my ski mask on that covers almost my whole face, you can't even tell it's me. Do I have to remove that so they can see my face and say, yeah, this is Mike and he
no,
lives?
because you don't provide an ID when you vote, you just give them a name. Any voting, you don't provide a license or anything, you just go in and say your name and precinct. We will be handing out gloves and masks, just like I'm gonna do at town meeting. There'll be bags pre-made of gloves and masks, and we'll hand them to people that don't have one. But, no, anyone could walk in and say, I'm Mike Wood, and
Well, there's only one of me, but I mean, my son looks like me and he could just wear his mask and say, I'm Mike, and I can, right? Okay,
but you could do that now, without a mask.
yeah, I don't agree with that either, but,
Anyone can request a mail-in vote?
Yep, so one part of the legislation that changed was, normally anyone can request an absentee ballot, but there are specific requirements that you're attesting to when you request an absentee ballot. You can't just request one for any reason. This most recent legislation allowed early voting by mail for any reason at all. So the state is encouraging it, towns are encouraging it. It's obviously the safest way. You send an application, it can be one per person in your family, fill it out, and then when the ballots are ready, which I think they just came in, we've been printing all the envelopes, so everything's pre-printed. She just stuffs it and mails it to the address, and then you either mail it back in or drop it off here. And then they're not open, they're all sealed until Election Day, just like an absentee ballot, and then not the registrars, the wardens from each precinct would take the unopened envelopes and feed them through the machine. So they're not opened ahead of time, they're not looked at ahead of time. Once they come in, the outside envelope is removed, so all you know is a precinct number of where it came from. You don't know who it is and anything about it. And then those are run through separately by the wardens.
Perhaps you
So-
could just, for the people that are watching, just run by the application process, what they need to do if they want to mail-in/absentee ballot.
Sure, it's right on the front page of our website, grovelandma.com. You can download the application and fill it out, email it in, mail it in, put it in our Dropbox. If you don't have access to a printer, you can call or email the town clerk. Her information is right on the front page of our website. She will email it out or mail it. It does require a signature, so you can't just mail it, you have to electronically sign it, or you have to have a signature. And then, like I said, you can request the early voting by mail. They have to be received, I think it's the Friday before the election, and then the ballot has to be received back by the close of the polling hours on Election Day.
Will they be able to drop them off in that box
Yep.
that's out there?
Yep,
Okay.
so most people are dropping off the applications currently, but you'd be able to drop off, as long as you put it in the sealed envelope without any, drop it off in that box, and then she'll just put it together, and on Election Day, they'll be opened and scanned through.
so we need a motion to change the polling hours from 10 a.m. to 6 p.m.
Yes, please.
At least one of you two.
I personally find it very difficult to restrict, even in these times, people's most important right they have is to vote. 10 to 6 just seems to me it's going to eliminate a lot of the working people who come in early or come in late. And that's a real concern to me. And I understand that the situation, and I understand they can request mail-in ballots as well.
That would be the easy solution. If you can't make those 10 to 6 hours, you request a mail-in ballot, and then you don't have to worry about it, right?
I understand that, but people are creatures of habit.
Well, I know.
Had the habit of, for 50 years, to come in and check that box or pull that lever or circle, color in that circle. Sometimes it's difficult to get over, and I'm hesitant to possibly disenfranchise anyone from exercising their most important right. You know, I don't know what the unintended consequences of such an action would be, and that's my biggest concern, because we've never been through this before.
Well, and let me just take it a step further, though. So, again, a couple things. She may not have people to work, and we only have 2 races with a contested race. She's expecting a significant number of write-ins, which all have to be counted on Election Day, which means if we keep the normal hours of 7 a.m. to 8 p.m., in the March primary, they were here till after midnight counting the votes. If you're talking that many number of write-ins, so another reason why the 6 o'clock was to give them extra time to deal with all the write-in people. So we're not requiring people to be here 13-plus hours. She just thought that would be more manageable. So those are really the reasons why.
Well, I agree with Bill. I mean, it's always been 7 or 8. People are creature of habit. A lot of people aren't gonna know that it's changed from 10 to 6. I think they ought to keep it at 7 in the morning to late at night, and not do the 10 to 6. And based upon that, it's almost like restricting people to vote. And I know they got the ability to do a write-in, do it by mail. But I'm gonna make a motion that we keep it 7 in the morning to late at night.
So how would you like to handle if we can't get poll workers? What would you like to do in that instance?
We gotta find them. Gotta find them.
And if we can't,
And when you're talking 2 hours at night that you're holding up, and you're talking 3 hours in the morning. It can be done. If you're with a limited staff, well, then maybe people have to do two jobs on election day. Maybe it's the same person that checks you in, checks you out.
can't do that. That's not allowed under the election statutes.
Well, I mean, you're talking 5 less hours.
I understand that,
I-
but the requirement is still, you need someone checking in, someone checking out, you need a clerk, you need a warden, I mean, there's still a required number of people we have to have. They've lessened it by, we don't need 2 people at check-in and 2 people at check-out per precinct. We can do 1 and 1, but there's still a required number of people we have to have. I can certainly let her know, but I don't know that she's gonna be able to get people to work.
I'm definitely not in favor, and I'm not gonna vote for 10 in the morning till 6 at night. Somebody's gonna lose out,
Okay.
and that's not fair.
All right, so we have a motion, is there a second? Do you want to second that?
So, the motion was 7 in the morning to late at night.
All right, so the motion doesn't carry. Bill?
Can I offer a compromise?
You
I
do
can
whatever
bring
you
it
want.
back, I can't, it's not my decision, it's the town clerk's, and this is what she's recommending.
I can understand nobody wants to be here late. It's not a great environment.
Well, it's not even late, it's just people just don't want to be here at all.
Yeah.
And you can't blame them for being concerned for their health either.
Heck no. Heck no. I can absolutely empathize with each and every one of them. And I feel for them, just like I do the grocery store workers and the doctors and the nurses and the firemen and the nurses and the policemen. Can we go earlier? I'm just looking at those hours and saying that the regular working guy or girl without the absentee ballot or mail-in vote will not vote. Because that 10 to 6 is going to exclude them, because those are your typical working hours. As a compromise, could we go earlier in the morning or later in the day, just so we can make sure that those people have every opportunity possible to cast their vote, whether, even in person? And I know we got the poll workers, this is a crazy situation.
Well, the other side to that is that that's a typical working environment that you're stating, from those early hours and late evening hours like Ed is talking about. most of the people are working remotely if they can, right? Which is a large population, so the hours don't really mean all that much.
Today, but we don't know by June 15th.
Right.
That may change significantly by then. And then I'd hate to, like I said, disenfranchise those people that have gone back to work and that typically work that 9 to 5, shift. Will they be able to vote if they don't request a mail-in or absentee ballot?
Well, I mean, there are options for them to vote, right? It's not like we're limiting the hours and this is your only option. There are other options for them to exercise their right to vote. It's
I
just
agree.
limiting the hours based on the people that we can have working here, and meet the requirements of the voting situation. So either way, you're doing it for safety and then you're limiting
Access.
hours, or you're keeping it open and you don't have people to work, and, you have more opportunity for in-person voting if that's what someone wants to do. So it's, this is why we get paid the big bucks, is to make these decisions, which obviously are gonna be, not gonna be happy for everybody, but some kind of decision needs to be made, and based on the recommendations from the town clerk, this is what she is suggesting. What are the other hours of municipalities that, you said that this is more generous, what are the other ones suggesting?
They're all over the place.
Is it less than 8 hours?
Oh, yeah, most of them are doing like a 4-hour window, because they're pushing everything. I was gonna text, I don't know if Beth is near her phone, but I was gonna text her to see when she had to have this decision by.
This is absolutely a true conundrum, no
It
doubt
is.
about it.
Because you can see the validity of each side, right?
Absolutely. And from someone that's taken that responsibility to vote seriously from the minute I turned 18,
Is she in the building?
I don't think she's still here.
So while you're doing that, what was the other item we had to discuss? The percentage of people required to be at town meeting, is that something that's forthcoming, or can we look at that tonight, or?
Well, you can't vote on it because the
Right.
legislation hasn't been finalized. It's just, we're waiting on, the governor has assured us that once the legislation comes through, if there are no changes, he will sign it right away. It's gone through the Senate, I believe, it's at the House. And like I said, the last version, it's changed a few times. The last version I saw was not less than 10% of the required number, and it would be limited to financial and necessity articles or immediate needs or something like that. So council looked at it and gave me the write-up, but we can't actually vote on that until that's finalized.
As far as poll workers and what's required to do that, is that something where members of this board could volunteer hours to do?
I don't know that that would be appropriate, where
Probably
selectmen
not.
is a spot on the ballot.
Well, obviously not Kathy, because she's gonna be.
No, but I
Oh,
still think it affects your board who wins, so I don't think anyone
do
who's,
anything.
I don't think any elected candidate should participate in the poll. There are some changes. The legislation allowed for a certain number of students, so she had reached out to the schools to see if there are any students that they could gather, but it's very limited to how many students. Some towns are using their call firefighters to see if they want to work the polls. We haven't gotten that far yet, to be honest with you, because we've been trying to figure out what we have to work with.
So even if I wanted to volunteer, I couldn't do it, or I shouldn't?
I
do it?
mean, you might be able to volunteer like crowd control outside, or you couldn't work, I don't think you could work in this room physically where the ballots are being cast. I would advise against that ethically.
do we even know if we have poll workers to work 10 to 6?
I don't know.
This whole conversation could be absolutely moot if we don't have anybody to work.
Well, we'll have to get people to work at some point. We have to have some number of hours. So, like I said, she just gave me this at 3:57 today, that 10 to 6 is her requested change. And in the conversations I've had with her, she was gonna put out another email. She'd already gotten feedback from poll workers that did not feel comfortable working. We were reaching out to the school. We talked about employees, if there's a need and if employees wanna come in that day and work. Those are the things we're still tossing around. But I think she needs to know what she's looking for. So if it's gonna be a 13-plus hour day, she's gonna need that many more poll workers to cover, because we only had, I think the last time we only had a handful of people that did the open till close. So we did a lot of split shifts. So she doesn't need to know tonight. She has to update the state elections office prior to the election, so.
Well, if she could get back to us and let us know the status of the workers for the hours she's proposing, that would help greatly. Or whatever hours could be covered, and then we can adjust maybe the 10 to 6 or 9 to 5 or noon to
10
8.
to 8,
Yeah.
or 7 to 6, you know.
Yeah.
But I think we're not allowing enough side on the early or the late to accommodate, I think, the people that, most of them gonna be essential workers, right?
And we can't voluntold someone to do it, right? I mean, like, if I wanted to voluntold someone in my house to do it, I couldn't do that. You can't do anything.
I mean, someone in your house is welcome to sign up to be a poll worker,
Yeah.
independently of you as a selectman directing them to do that, but, so she's gonna check tomorrow.
You're ready to take hear a lot of guff from that.
I was just wondering I'm just trying to find an option.
She's gonna check the deadline tomorrow, and then her and I will regroup on Wednesday to find out how many people we have and for what hours. and
That would
then
be helpful.
We can discuss it next week.
Yeah.
If it needs to be done before next week, we'll have to convene a meeting later this week, but I'll let you know that.
Okay. I think that would help, I guess, the three of us come up with some kind of consensus that'll work, because, I mean, right now, I have no idea. And you guys are clearly leaning towards keeping it more to normal hours, which isn't a bad decision, it's just a decision.
I'd like to see it restricted. I mean, I can understand the obvious reasons, but I think that's maybe too restrictive. That's my only concern.
Well, based on what Denise is saying, it's actually a lot more robust than other towns.
Yeah, I'll give you comparisons to what other communities have,
Next week? Or,
at our next meeting, yeah.
okay.
I have one more thing. So the highway yard, the board only voted for the first 2 Saturdays. It's working out well. This past Saturday, we used one of our B-team staff members with strict orders to stay in his car. He's not to get out, he's not to interact, he's not to get in anyone's car and drive it. So that worked out well. So we would like to propose that we continue just on the Saturdays, 8 to 2, with the 2 staff members.
May I ask which B-team member this was?
Yeah, you can go back.
Yes.
Oh, thanks for letting me know.
Ed-
We
it's
just
finished.
I'm just kidding with you.
Ed Reed.
And he would, please speak again of on those requirements, because I was there Saturday, and I don't think that those 2 things took place. So can you tell us that again?
Well, it didn't come
He was-
from me. He was told by the highway superintendent, he has to stay in his car, could not socialize, could not be chit-chatting, could not be roaming around, could not be driving people's vehicles, could not be backing up to the pile.
Okay, I'm gonna tell you right now, as an eyewitness, because I was there Saturday, he is not following those guidelines.
What we're discussing
Well,
right now.
to be
Highway
quite frank,
department
when we
and,
put it to the
recycling.
he was not supposed to be there. It was strict
Ed Reed.
requirements of staff members only, current
was the highway
employees.
guys.
Apparently, he couldn't
was
get employees to
volunteer.
work, so he went to,
She said no one can volunteer.
his B team.
B-team.
That's what he calls them, the B team. That's what Bob used to call them.
So is that the same thing that we're looking to vote on for the next 4 Saturdays with the A team and B team, or?
Well, I think the plan is to staff it with 2 people however he can. If he can get 2 employees, if not, he may use 1. But if we need to talk to him about making sure that he's staying in the vehicle and not interacting, and then we'll have to,
Again, if I'm available, I will volunteer to sit in my car for a few hours down there so we can have those hours open for the residents. And I can social distance like anybody.
Question?
Yeah,
It was from 9 until 2, right?
8 to 2.
8 to 2.
8 to 2. So the first day, I know was a really lousy day, and I did go down there like around 1 or so, and I didn't see anybody there. So I'm
Yeah, I went down
wondering-
around noon, there was nobody there.
I
really.
was wondering if you could just maybe restrict it to the morning hour. I mean, if we're gonna, because we're paying time and a half, right? So, I mean, if we could
Yeah,
just
but I think
open it-
that 8 to 2 gave a good window for everyone to kind of stagger there.
But it
there.
didn't seem to be an issue, is what I observed.
Right, but I think
So-
that's why it wasn't an issue, because there was that wide range of openness for people to go into. Like, I wasn't down there at 8, I don't know what the traffic was like
Well,
at 8.
I would just wonder, did they track it all? Did they keep track of when people came in? Because if
I
they
don't
need
think that-
just the morning hours, I think that simplifies it a little bit. Right?
I think the 8 to 2 was good, I don't know what,
It was staggered all day.
yeah. Yeah, I mean, I think there was maybe 2 other people when I went at noon, and I was only there for 10 minutes and then I left, so.
Right. So you think the wider,
I think the 8 to 2 actually worked out well, and
Okay.
on both days, right, I think?
It was 8 to 2 both days.
Yeah, I
And
think
we
that
did
that
have
worked out
people
well.
coming in.
I think that the breadth of hours there, the bandwidth allows people not to
Rush in, yeah.
rush in with such a restrictive hours. So I'd make the motion that we continue to open the yard at 8 to 2 on Saturday for the next 2 weeks, 4
Yeah,
weeks.
just do it in 2 weeks and see how it goes.
2 weeks?
2 at a time?
2 weeks
Yeah.
at a
2
time?
at a time.
We have a motion, is there a second?
I'll
Second.
it.
Second by Ed. Any further discussion?
Nope.
I will add again that I will volunteer if needed. I mean, I can't volunteer for the polls, I guess, but I'll volunteer for the highway department if they need somebody else.
Put me on that list too.
Bill's on the list too, so call my phone, email me, let me know if I'm available. I'll go down and sit there for 3 hours and drink my coffee. All those in favor?
Discussion?
Oh.
More discussion?
Yeah.
Yeah, go ahead.
The B team needs, or somebody needs to reinforce the guidelines of the B team.
Like I said, I didn't even know they were there until today, when you told me it was, who was down there,
Okay.
so.
Well, that's why I wanted to know who the B team was, 'cause he greeted me with a big smile, came right up to the car door, you know what I mean? So,
All right, all those in favor? I think that's it. Any other topics? We got a couple of minutes before we gotta
I
go
want
in.
to thank you both for all that you do. I appreciate it, and so do everyone that does. I'm sure you probably don't hear it, thank you enough. But really, you're to be commended for all the work you do.
Thank you.
Really is appreciated.
Thank you.
Okay,
Thank you both. And thank Mike again for the statistical stuff. I love getting
so should
that.
we adjourn this meeting and,
So you should make a motion to enter executive session, and you will not return to the public meeting, and then we'll just adjourn
Do
in
we have to
executive
reach
session.
the right time, or does it matter?
No, you can just, we're not gonna start, we're just gonna adjourn right now. You're gonna, motion to go into executive session. is what you're gonna
we'll
do.
roll call. Can someone make a motion for that?
Motion to move to executive session,
And you will be adjourning in the executive session.
and we'll be adjourning in the executive.
Don't we have to say the pursuant to thing?
That's fine.
I'll read it.
Read it.
Can we get a second?
I'll second.
Ed seconded, so pursuant to Mass General Law, Chapter 30A, Section 21A2, for the purpose of renegotiating the terms of fire chief's employment contract, votes may be taken, so we'll roll call. Ed?
Yes.
Bill?
Yes.
Kathy?
Yes.
And myself, yes.
I can turn this off now.
Yes.